Phlebotomy Certification Guide. Question 1. What is the best practice if blood begins to clot in an anticoagulant tube? Option A. Continue processing. Option B. Recollect with proper mixing. Option C. Add water. Option D. Store at room temperature. The correct answer is option B. Recollect with proper mixing. Clotted specimens in anticoagulant tubes are unacceptable for most analyses and must be recollected. Adding water or continuing processing would produce erroneous results. Recollection with immediate, proper tube inversion ensures a valid specimen. Question 2. Which tube is used for hematology testing? Option A. Green. Option B. Lavender. Option C. Red. Option D. Gray. The correct answer is option B. Lavender. Lavender top tubes containing EDTA are the standard for hematology testing, including CBC and differential, because EDTA preserves cellular morphology and prevents clotting without affecting cell integrity. Green, heparin, tubes are used for chemistry. Question 3. How should blood from an 4 line be collected? Option A. Above foresight. Option B. Below foresight after turning off infusion. Option C. From same 4. Option D. Ignore 4. The correct answer is option B. Below foresight after turning off infusion. If no alternative site is available, blood may be collected distal to below the foresight after the infusion has been discontinued for at least 2 minutes and the first 5 ml discarded to clear for fluid contamination. Drawing from or above the foresight produces diluted, invalid results. Question 4. How should a heel stick be performed on an infant? Option A. Medial or lateral plantar surface. Option B. Center of heel. Option C. Arch of foot. Option D. Toes only. The correct answer is option A. Medial or lateral plantar surface. CLSI guidelines specify that infant heel sticks should be performed on the medial or lateral plantar surface of the heel to avoid the posterior curvature and calcaneus bone. Puncturing the center or arch risks bone injury, osteomyelitis, and nerve damage. Question 5. Which tube is typically used for glucose testing? Option A. Light blue. Option B. Gray. Option C. Lavender. Option D. Red. The correct answer is option B. Gray. Gray top tubes contain sodium fluoride, which inhibits glycolysis and stabilizes glucose concentrations for up to 24 hours at room temperature. Without a glycolytic inhibitor, glucose levels drop rapidly as red blood cells continue metabolizing glucose in the sample. Question 6. If a hematoma begins to form, the phlebotomist should: Option A. Continue drawing. Option B. Remove needle and apply pressure. Option C. Apply cold compress only. Option D. Massage site. The correct answer is option B. Remove needle and apply pressure. Upon observing hematoma formation, the needle must be immediately removed and firm direct pressure applied for 3 to 5 minutes to stop bleeding. Massaging the site can worsen bruising, and continuing the draw would further damage the tissue. Question 7. If a patient refuses venipuncture, the phlebotomist should: Option A. Force the draw. Option B. Notify the nurse/physician. Option C. Document refusal and stop. Option D. Restrain the patient. The correct answer is option C. Document refusal and stop. Competent adult patients have the legal right to refuse any medical procedure. The phlebotomist must immediately stop, document the refusal in the patient record, and notify the ordering clinician. Restraining or forcing a draw constitutes battery. Question 8. An evacuated tube fills by: Option A. Capillary action. Option B. Gravity. Option C. Vacuum. Option D. Syringe suction. The correct answer is option C. Vacuum. Evacuated, vacutina, tubes are manufactured with a preset vacuum that draws blood into the tube automatically upon needle-to-vein contact. The vacuum is calibrated to fill the tube to the correct volume to additive ratio, making proper fill critical for accurate results. Question 9. When a specimen label differs from ID band, phlebotomist should: Option A. Draw anyway. Option B. Correct on computer later. Option C. Re-verify patient and relabel. Option D. Ask another phlebotomist. The correct answer is option C. Re-verify patient and relabel. Any discrepancy between the specimen label and the patient's ID band must be resolved before collection by re-verifying the patient's identity using two independent identifiers. Drawing without resolving the discrepancy is a critical patient safety error. Question 10. Which tube is used for chemistry testing? Option A light blue, option B green, option C lavender, option D gray. The correct answer is option B, green. Green top tubes contain heparin, lithium or sodium, as an anticoagulant and are used for plasma chemistry testing when results are needed rapidly, as they do not require clotting time before centrifugation. Light blue is for coagulation and lavender for hematology. Question 11. Capillary blood differs from venous blood because it, option A, has more oxygen, option B, mixes arterial, venous, and tissue fluid, option C, clots faster, option D, is less suitable for glucose. The correct answer is option B, mixes arterial, venous, and tissue fluid. Capillary blood is a mixture of arterial blood, venous blood, and interstitial and intracellular fluid from the punctured tissue, making its composition slightly different from pure venous blood. This is clinically relevant when comparing capillary versus venous reference ranges. Question 12. Which is an appropriate action if a patient's vein collapses? Option A, apply more pressure. Option B, try a smaller needle or alternate site. Option C, continue until blood flows. Option D, give fluids. The correct answer is option B, try a smaller needle or alternate site. Vein collapse occurs when vacuum pressure or aspiration force exceeds the vein's integrity. The appropriate response is to switch to a smaller gauge needle, reduce vacuum pressure, for example, use a butterfly with syringe, or select an alternate venipuncture site. Question 13. Labeling specimens should be done. Option A, before collection. Option B, while patient waits in reception. Option C, at the patient's side after collection. Option D, at the end of the day. The correct answer is option C, at the patient's side after collection. Specimens must be labeled immediately at the patient's bedside after collection while the phlebotomist can directly verify patient identity. Pre-labeling or delayed labeling significantly increases the risk of mislabeling and patient safety errors. Question 14. The gauge of a needle most commonly used for adult venipuncture is option F 14, option B 18, option C 21 to 23, option D 25. The correct answer is option C, 21 to 23. 21 to 23 gauge needles are the standard range for adult venipuncture, balancing adequate blood flow with minimal patient discomfort and vein trauma. Smaller gauge numbers indicate larger bore needles. 14 gauge needles are reserved for trauma or rapid transfusion scenarios. Question 15. What color tube is commonly used for coagulation studies such as patient/INR? Option A green, option B lavender, option C light blue, option D red. The correct answer is option C, light blue. Light blue top tubes contain sodium citrate, which chelates calcium to prevent clotting and is specifically required for coagulation studies including patient/INR. The lavender tube contains EDTA and is used for hematology, not coagulation testing. Question 16. Which action is required after a phlebotomy procedure? Option A, leave patient without instructions. Option B, instruct patient to flex arm vigorously. Option C, apply pressure and bandage. Option D, ask them to shake hand. The correct answer is option C, apply pressure and bandage. After needle removal, firm pressure must be applied to the puncture site for several minutes, followed by a clean bandage, to achieve hemostasis and prevent hematoma formation. Patients should be instructed to keep the bandage on and avoid heavy lifting, not to flex or shake the arm. Question 17. Icteric specimens are caused by option F, high lipids, option B, high bilirubin, option C, low glucose, option D, high potassium. The correct answer is option B, high bilirubin. Icterus refers to the yellow-orange discoloration of serum or plasma caused by elevated bilirubin levels, seen in conditions such as liver disease and hemolytic anemia. This is distinct from leukämia, milky appearance, and hemolysis, pink-red discoloration. Question 18. A fractured vein more likely causes: Option A, quick flow. Option B, hematoma. Option C, no blood return. Option D, arterial puncture. The correct answer is option B, hematoma. A fractured or damaged vein wall allows blood to escape into surrounding tissue, resulting in hematoma. This may also cause blood flow to slow or stop during collection. Prompt needle removal and pressure application are required. Question 19. The best angle for venipuncture is: Option A, 5 to 15 degrees. Option B, 45 to 60 degrees. Option C, 90 degrees. Option D, 25 to 40 degrees. The correct answer is option A, 5 to 15 degrees. A needle insertion angle of 15 to 30 degrees, commonly stated as 15 degrees in standard practice, is recommended for venipuncture to allow smooth vein entry without passing through the posterior wall. Angles above 45 degrees risk through puncture and hematoma. Question 20. Which action is correct if a patient experiences syncope? Option A, lower patient to supine. Option B, leave patient standing. Option C, continue venipuncture. Option D, apply tourniquet tighter. The correct answer is option A, lower patient to supine. Syncope requires immediate needle removal and lowering the patient to a supine, flat, position to restore cerebral blood flow. Leaving the patient standing or continuing the draw risks serious fall injury and worsens the vasovagal episode.